So my name's Chang, Dr. Park. I'm one of the GPs here and I work at the health centre at King's College. And the health centre is like any other NHS GP practice, but we're based on campus at King's and we're here really dedicated for the care of students and staff at King's College. So if you've got a concern about your mental health, I would say first of all just come and talk to us first off. I mean, you can expect some time with the GP like you would come for any other physical mental health problem, and as with any other problem, any medical problem, all your details are strictly confidential. We don't really have any connection with college. There's no transfer of information between the university and the health centre because it is a medical centre and everything is confidential. Unless you want that to be the case, unless you want tutors to know or you need some medical information to be passed on to college. So students will often come and see us with an initial concern that something's been going on, or they've been worried about their mental health, they've been feeling depressed or anxious, or simply not managed to cope with something, or an event has happened and they need some support. They simply don't know what to do. And in that instance I would ask people just to make an appointment and make that initial first step to talk to someone. And we take it from there. And a mental health appointment is like any other appointment. So we listen carefully to what's happened and try and find a way together to improve things, make things better, and make you feel like you can take control of the problem. Well, I would say when it comes to medication, as a GP, we actually have to get to know your situation and the nature of what's going on with your mental health before we'll consider medication. It's certainly not an automatic thing that you'll be placed on medication or forced to take medication. There are some instances where doctors will feel like you might benefit from medication, but actually this is very much a collaborative decision. And we give you the option of using medication if we think it will be helpful for you individually, and that's definitely not in the majority of cases, but yes, it is something that we use if we think it would be helpful. The other thing to say about medication is that people often feel worried about side effects, or they feel worried about how long they need to take medication for. And this again is very individual to each case, and I would say that medication that we use for depression or anxiety, for example, they're not addictive medications. They're there to be used for a certain period of time, sometimes for a few months, sometimes for longer if people need that, and they're nothing really to be afraid of. And we will monitor you very closely when you're on medication. You won't be left alone. Okay, so we do have some resources to hand that we can refer you to. This includes the counselling department at King's, external counselling services outside of King's. CBT, for example, is a very effective and popular therapy that we often refer people for. There's also, I think students don't always think about other resources like Active Wellness Scheme, the Wellbeing Group, and these groups and resources shouldn't be underestimated, because on top of your traditional medication and therapies that people think about when treating mental health, the wellness aspect, activity, exercise, socialising, all of that is really, really important in getting your mental health back on track. Okay, so when it comes to lifestyle factors, we do know that having a good lifestyle in general, so what is a good lifestyle? It means having a good sleep regime, having a healthy diet, exercising. All of these things are very important, not only just for your physical health, but it's more recognised now, and there's good evidence that particularly exercise, regular exercise, is very good for your mental health, and in fact we use it sometimes as a treatment for mental health. In terms of lifestyle, I think additionally, most important for the student population, drinking, alcohol and drug use can be detrimental if used to excess, and sometimes we will ask about this to see if we can help you manage the use of drug and alcohol, because sometimes these substances can perpetuate mental health conditions.